the study guide or exercise for exam 2. And exam 2 is also a midterm exam. It is over chapter 5, 6, 7, and 8. Okay, instruction for this exercise. Make sure you study chapter 5, 6, 7, 8 before taking this exercise. And then prepare papers, pens, or pencil to write your answer. There will be about 2-3 seconds after each question to write your answer. And then you can stop or pause the video if you need more time. After finish the exercise, check your answer, how many corrects, how many incorrects. Repeat the process until you get 100% correct answer. And make sure that 100 correct answer is from your knowledge, after you study, not from your guess. And it is very likely that you will get a very good score for exam 2 or midterm exam if you follow this instruction correctly. Okay, we start with number 1. Which of the following may be defined as the antigens? Antigen. A, B, C, or D. So antigen is something, okay, like maybe bacteria, dandruff, okay, a hair, or allergen that coming from outside. It's not from inside. So like pus, sweat, exudate, this is from inside. So this is not antigen. And these 3 things will not causing your antibody to fight it. So antigen is something that enter into your body, and then your antibody try to fight this antigen. So the correct answer will be the allergens, which is something that coming from outside, maybe pollen and etc. Number 2, it is suspected the patient has TB, tuberculosis. Okay. Upon the provider's order, the nurse will administer which of the following tests? So what is the test for checking or to know the TB? A, B, C, or D? Okay, of course, A will not be the answer because this is for allergy. Okay? This is for TB. Which one? This one over here, right? Which is called the Mantoux test, which is TB skin test. Okay, so this is TB skin test. The next one, chickenpox is a rash caused by A, B, C, or D. Okay, it is caused by viruses. And there's special virus that's causing the chickenpox. Okay, it's called the VZV. Okay, V is for varicella. This is chickenpox. Okay, and Z is for zoster, which is this is the one that causing shingle. Okay, so chickenpox and shingles, they are related. And the V, of course, for viruses. So VZV viruses. So the answer will be for chickenpox will be the varicella. Number 4, smallpox is an infectious disease caused by A, B, C, or D. It is also caused by virus. The virus that causing smallpox is called variola. There are 2 types, major or minor. Okay, variola major is very dangerous because it has 80% mortality rate. Okay, but the good thing, this variola major has been eradicated by vaccination. Okay? So it is good that the smallpox major is not around in this world anymore. At least that's what happened in 1980. Okay? So it's variola. Herpes. Okay? Herpes viruses can cause chickenpox. smallpox, cold sores, or measles. Okay, there are actually 8 herpes viruses. Okay, one of them causing the chickenpox. Okay, which is this is VZV viruses. Smallpox is not caused by the herpes viruses. Okay, the herpes virus can also causing the cold sore. The cold sore. So this is also herpes simplex virus number 1. Okay? Measles is not caused by the herpes viruses. So the correct answer will be this one, even though VZV or the chickenpox is also correct, because this is actually number 3. Cold sore is the best answer. Okay, so cold sore or mouth sore is the best answer for this question. Next one. The overproduction of sebum, sebum means oil. Okay, so oil can cause a melanoma, burn, seborrhea, or lupus. Okay, melanoma is not, this is a skin cancer. Burn, of course, this is a skin burn, maybe by light or fire, or maybe acid. Okay, lupus is a type of autoimmune disease, which is not. Okay, so seborrhea is the correct answer. It means that overproduction of sebum oil. Okay, overproduction of skin oil. A type of skin cancer is, we already mentioned that before. Okay, which one is skin cancer? A, B, C, or D? This is melanoma. So melanoma is a type of skin cancer. There are 3 main types of skin cancer. One of them is melanoma. This is the most dangerous one. Number 8, a graph that use skin from one's own. So this is self. Okay, culture or self tissue. Okay, is called auto, iso, sino, or allo. Self also means auto. So therefore, it is going to be the autograft. Grafting from our own tissue. Okay, like skin graft. A graft that use skin from different people is known as auto, iso, sino, or allo. Okay, auto, we already use it. And this is from ourself, our own skin. So if it is from different people, that's gonna be the allograft. Okay, so allograft. Okay, how about if it is coming from different species? Okay, maybe from the skin of animal, for example. Okay, so we graft. Okay, the skin is actually coming from animals. So it's gonna be, this one is not, this one is not, it's gonna be sino. Sino mean alien or other species. Okay, so xenograph. Identify the combining form of adipo. Adipo. Adipo means fat. Okay, so this is fat or fatty. Okay, so which one's going to be? Was fatty. Okay, adipose tissue is mean fat tissue. Identify the combining form of dermatome. Derma means skin. So derm means skin. So this is going to be related to skin. So the answer will be skin. Identify the combining form of hydro. Hydro. Okay, as we know, this is hydro, water. Okay, so hydrology is the science of water. Okay, so the answer will be water. Identify the combining form of ichtio. Ichtio. There is a science called the ichthyology, which is learning about fish. Okay, so ichtio means fish. And fish, they have scales. Okay, so like, this is a fish. Then they have the scale. Okay, like that. So it could be main fish or scale. Fish or scaly. Identify the combining form of kerato. 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 Eh? A, B, C, or D. Kerato is meant the skin that is very hard. Okay, like horny. Okay, so this is gonna be mean horny tissue. Okay, hard skin tissue. This is the one that protect us from water, for example, the losing of water, dehydration. Okay. Identify the combining form of pillow. Okay, so pillow. Okay, this means hair. Okay, pillow mean hair. Or it's a small channel. Can also mean small channel. Okay, like braids like this, like hair. So it's gonna be hair. Identify the combining form of myco. So myco. Sometimes we learn of mycology, a science of fungi. Okay, so myco means fungi. Identify the combining form of melano. So melano. Melano is a pigment that has a dark color. Dark pigment. Okay, so it's gonna be black. Okay, black. Melano means black or dark pigment. This is the one that gives the color to our skin and also to our hair. The prefix pertaining to fingernails. Prefix for fingernails. Ser, onco, trico, or onic. The answer will be the onic. It means fingernails. A teenage patient has skin eruptions on his face and upper back. The nurse recognized this as, okay, A, B, C, or D. So teenagers, they usually produce a lot of androgens. Okay, this androgen increase the sebum or oil production, right? And then it will cause some bacteria to, give the infection in this area. So the infection is caused by bacteria is called acne. So acne mostly, present in a teenager when they reach their puberty because they produce a lot of androgens over here. So this is acne. Which of the following terms refer to fatty tissue? We already mentioned that fatty adipose. Okay, so the answer will be adipose tissue. Excessive production of sebum. Okay, well, I think we already have this one, right? It's known as seborrhea. As sebum oil, rhea means over or production. So overproduction of oil from the oil gland is called seborrhea. This is a malignant cancer of the basal layers of the epidermis. So there are several skin cancer. One of them is coming from basal cell. Okay. The other one is coming from squamous cell. And the last one is coming from melanocyte. Okay. If it is coming from basal cell, then it is called the basal cell carcinoma, which is not that dangerous. Okay. The most dangerous one is malignant melanoma. So the answer, basal cell carcinoma. This is the most dangerous type of malignant skin cancer that arises from melanocyte, okay, dark skin cell that produce melanin. Therefore, the skin cancer that arises from this melanocyte will be very dark in color. And the name will follow the name of this cell. So will be the malignant melanoma. This is the most dangerous type of skin cancer, malignant melanoma. A large blister is an blister in the skin. If it is very large, it's called bulla. Bulla is a large blister in the skin or on the skin. Exposure of skin to heat, chemical like acid, for example, electricity, might result in bulla, burns, erosion, or fissure. Of course, it can cause what we call the skin burns. Okay, so burns. The healthcare provider identifies a localized pus producing infection that originated in the hair. So it originates from the hair follicles. So this type of infection is called, it's a special name if it is coming from the hair follicles, the infection that produce the exudate or pus, then it is called the furuncle. Okay, furuncle, if there is a pus that coming from the hair follicle infection. This is the surgical repair of skin. So what is the name? Okay, skin, derm, so should be one of this. Okay, but for repair is called the plasty. Okay, surgery that repair something is called plasty. So there's going to be dermatoplasty. Dermatology means the science of the skin, which is not the answer. Okay, so the answer will be dermatoplasty. Okay, just look at the keyword skin. So you're going to look for a derm as a skin. The patient is sweating profusely. So sweating. This would be documented as A, B, C, or D. So production of sweat is called the diaphoresis. So this is sweat production. So this will be the answer. Okay. The acute form of dermatitis, which is skin infection, okay, it's going to be very itchy, okay, blister, itchy, okay, and this one is called A, B, C, or D. It's called the eczema. Okay, so eczema is a acute type skin infection or dermatitis. An inflamed hair follicle is known as, so this is just inflammation. It's not really producing pus or exudate, okay? So it is gonna be, it's not furuncles, okay? Remember, furuncles will produce the pus, okay? Candidiasis, this is caused by fungi, which is not, okay? So the answer will be folliculitis. This is inflamed of hair follicle. What occurs with the necrosis? So necrosis is mean cell death. Okay, so that's necrosis. Okay, So it's going to be tissue death. Okay, if the cell of the tissue death, then it can cause the death of the tissue. Okay, so necrosis, death, or tissue death. Chronic ulcer on the skin of a bony part due to the pressure. Okay, so due to the pressure, sometimes, if someone cannot move in one side, they just sleep in one side, it can cause this chronic ulcer. And it is called as the cubitus. Okay, the chronic ulcer due to pressure. Another term for pus, okay, this is usually contents of whitey color fluid with blood. Another name for this is called exudate. So exudate is another name for pus. The patient states he cannot stop itching. Okay, so it's very itchy. How will this be documented? So itchy, okay, so the terminology for itchy is pruritus. So this is a pruritus. Very itchy, cannot stop scratching. The blackhead. Another name for blackhead is A, B, C, or D. Of course, it's not this one, not this. This is infection. Blackhead is called a comedo. Comedo. This is a firm raised mass of scar tissue. Okay, so sometimes if you work very hard, okay, in your finger, you have this kind of raise of the tissue. Okay, this one is called keloid. Okay, so keloid is the firm raised mass of scar tissue. Okay, if you work very hard, your skin, your hand, for example, might have that keloid. A polyp is A, B, C, or D. This is something that, okay, so like this, going upward. Okay, so this is more mass that projects upward. So this is a polyps. Cutting of tissue for microscopic examination is called. So cutting a little bit tissue, like for example, maybe like, let's say this is a breast, take some tissue from here to check whether there is a cancer or tumor or not. And this process is called biopsy. Okay, so this is biopsy. Athlete foot is caused by what type of infection? So athlete foot is a type of stubborn infection of fungi. It's caused by fungi. A plantar wart. This is plantar. Okay, so plantar wart is caused by viruses. Okay, occurs on which part of our body? Of course, plantar. Okay, if it is your foot, the plantar is this area, the bottom part. Okay, therefore, okay, this is will be on foot. Okay, so plantar wart. Shingles are results of A, B, C, or D. Already mentioned that, okay, that chickenpox and shingle is coming from the same type of virus called the VZV. So this one is varicella, and this one is zoster. Okay, if you have chickenpox when you young, you might get shingle when you are older. So this is shingles. This is chickenpox. is coming from the same viruses, which is herpes viruses. Okay, it's a type of herpes viruses. Pediculosis is an inflammation caused by A, B, C, or D. So pediculosis, this is a bug. Okay, it's a bug. Okay, so usually live on hair. Okay, so it's a lice. So lice is an animal. Okay, so the one that is animal is insects over here. So insect is animal. Okay, that has three legs. Okay, three pairs of legs. So this is insect. So this is a lice, which is the infection or the disease is called the pediculosis. It's caused by this lice or insect. The lower jawbone, so lower jawbone is known as, okay, so the lower one, lower bones over here, okay, and then we have the upper one. So this one is called mandible, okay. The one that is on the top is called maxilla. Okay, so lower will be mandible. The upper jawbones, okay, this is the upper one, will be maxilla. A joint or point where two bones meet is known as the joint. Another name of joint is arthrosis, okay, or articulation. Okay, so joint, arthrosis, articulation is the same name. So this one should be C, articulation. Physicians who focuses on treating disorder of the foot is an, so foot. Okay, foot is pedi, is a foot. Podi is also foot. Okay, it's the same. So it's gonna be between this. Okay, so which one gonna be? Okay, so pediatric right now over here is mostly for kid, yeah, pediatrician, which is a kids or a children doctor. So the correct answer will be podi. Okay, podiatrist. A graphic image of electrical activity of muscles. Okay, electrical and muscle. This is the two key words. So muscles mean myo. Okay, electric, of course, electro. So just look for that. So this is electro, so it's gonna be electro, and then there is myo, which is muscle. So that should be the answer over there, electromyogram. So look for the keyword if you don't know. Muscle that contract abnormally, okay, abnormally in disease such as multiple sclerosis or MS are, okay, which one? Spastic, flaccid, rigid, or rigorous? Of course, flaccid is not. Flaccid means the muscle cannot move. Okay, this is when you cannot move your muscles, that's gonna be flaccid. So the one that will contract abnormally will be spastic, like a spasm, abnormal contractions of muscle, spastic. Osteomyelitis. So osteomyelitis may be caused by in the bone. Of course, this is osteum in bone. Myelitis is infections in the bones. So it's going to be infection. Okay. So itis over here is mean infection. Okay, so this is infection in the bone, usually caused by bacteria. A wasting away of tissue, organs or cell, usually the result of disease or loss of blood supply, is known as, so wasting away mean A, okay, atrophy. Okay, so the muscle, like for example, if never being used, it's gonna be very small. Like people with polio, for example, their leg muscle is very small. It's because of atrophy. Okay, so wasting away tissue. A surgical procedure to repair a bone is known as, so this is repair the bone. So look for osteo. Okay, so we have osteo. Okay, repair, surgical repair is plasty. Okay, so plasty. Look for that one then. Osteoplasty. An analgesic is used to assist with A, B, C, or D. So analgesics is less actually pain. Okay, this is pain reliever. Okay, this is pain reliever. So it will be assist in pain. So analgesic is a pain reliever. NSA, NSAIDs, okay, do not contain what, but do reduce inflammation. So you should know, okay, the abbreviation for this one. So NSAID is stand for non, okay, non-steroid, okay, anti-inflammation drugs. Okay, so it means that the drugs used for inflammations, reduce inflammation, but this drug does not contain the steroid. So it does not have steroid. Steroid is very expensive actually. Okay, so usually people inflammation, if they use steroid, it will be injected. But there are some drugs that do not contain this steroid. Okay, it's called the NSAID, non-steroid anti-inflammation drugs. Yeah, including Tylenol is one of content this is a type of these drugs. Okay, and incisions into a bone. So this is osteo. Okay, so bone is osteo. Incisions, okay, is an automy or anatomy. So it's kind of cutting. So the answer will be osteotomy, cutting of the bone or incision to the bone. The physical therapist is performing adduction. So adduction, okay? So adduction on the skeletal system. This movement is in which direction? So I think you still remember on the first exam, okay? So if it is your hand, your body, okay? So adduction means going towards your body. So this is add. Okay, add. If it is going away from your body, it's called ab. Ab. Okay. So adduction toward the body, abduction away from the body. So look for the one that's toward the body. Match the combining form of calcaneus. Okay, calcaneus. Calcaneus, this is related to the foot area. Okay, if you have foot like this, so we have heel, right? And we have ankle over here. So calcaneus is the heel. Okay. So heel, calcaneus bones over there. Match the combining form of carpo with its closest definition. Carpo, okay, carpal, okay, if you have hand like this, you have carpals over here, carpal bones, okay? So this is on the wrist. So this is the wrist bone. So carpal or carpal mean wrist. Match the combination of tarso, okay, tarso, and this is, if this is your foot, this is tarso over here, which is the ankle. Okay, so we have 7 ankle bones over there. So tarso means ankle. Match the combining of brachio with the closest definition. If you have a hand, okay, let's say look like this. Okay, okay, brachio is this area, the upper hand. Okay, so upper hand. And so it's gonna be the upper arms. Okay, the arms related to the arms, brachio. Match the combining form for cephalo. Cephalo means head. So this is head. Okay, so head means cephalo. How about cervix? Okay, cervix means the neck. Okay, you have head, you have neck. This is cephalo, this is cervix. Okay, that's like that. Okay, so the neck. How about osteo? We already mentioned this several times. Osteo means bone. Okay, osteo means bone. Okay, now how about chondro? Chondro, this is a soft bone. Okay, soft bone, or it is also known as cartilage. Okay, so chondro means cartilage. Myo, we already mentioned that. Myo means muscle. Okay, so myocyte means cell. So it's going to be muscle cell. Okay, so myo means muscle. Match the combining form of condylo. Condylo. Okay, condylo. This is related to our hand when we do like this. Okay, when we want to hit someone, so you have this the knuckle, the knobs. Okay, so the knobs. Okay, the knobs. Okay, so the other example is when you have a bone that look like this. Okay, so this is a condyloid. Okay, look like a knob. Okay, condyloid articulation is a type of joint. So the knobs. How about costae. Okay, this is if you have breastbone, then you have 12 pairs of ribs. Okay, so this is the ribs. So costae means ribs. How about cranio? Okay, cranial. Okay, cranial mean the skull. Okay, cephalo, head. Okay, cranial is the bones of the head. Okay, so this is bone. This is cephalo is the whole head. Okay, so cranial mean the skull. How about dactylo? Dactylo. Okay, dactylo is this. Okay, 1, 2, 3, 4, 5, which is fingers. Okay, dactylo mean fingers. Kypho. Okay, what is kypho? Kypho. Okay, so maybe you see the movie The Beauty and the Beast. Okay, so the beast, let's just look like this. Okay, it has this. It has hum on it. Okay, it's called the kypho. So he has abnormality of bone is called the kyphosis. It has hum on it. Okay, so this is the beast. Okay, Beauty and the Beast. So this is the hum. How about scolio? Okay, scolio, if you see someone there, okay, their back over here is not straight, it's crooked. Okay, so this one means, so someone that has scoliosis, it has a crook backbone over here, right? Scapulo. Yeah. So it is actually the bones on our back, the shoulder bone, okay, or the shoulder blade. So scapula mean shoulder bone or shoulder blade. How about podo? Okay, podo, pedi, pedal. Okay, they're all related to foot. Okay, so this is foot. Pedi is the same. We just mentioned that. Okay, podo, pedio is the same name for foot. Patello or patella. So we have a bones on our knee. It's called the patella. So patel means knee. The breastbones or extend down to the chest. So there is a bone here. It looks like this. Okay, this is called the breastbone. Okay, and then from breastbones, you're gonna have the ribs. Okay, so ribs. So another name for breastbone is sternum. Okay, so this will be sternum. This is the result of a vitamin B deficiency. Usually, and on the kids, okay, if the kids have this type of leg, so their leg is like a bow, okay, like this one, okay, bow leg. It means that the bone is not very strong. Okay, it's not strong because what? They have deficiency of vitamin D. And this disease is called rickets. Okay? So rickets is a bow leg or deficiency of vitamin D. Pain radiating down the leg from the lower back is known as This is what we call the sciatica. Okay, this is pain that going down from our back to our legs. It's very painful. The physicians documents the patient has myalgia. So algia mean pain, okay? Myo mean muscle. So they combine together. So it's gonna be muscle pain. Inflammation of nerve. Okay, nerve is neurons, okay, related to neurons. So inflammation is itis. Okay, you just combine this neuron and itis, is gonna be neuritis. This disorder may be associated with Parkinson's disease. So Parkinson's disease, what happened? They're unable to control their muscle movement. So they have the tremor, always moving their muscles. The medical assistant recognized a symptom of Alzheimer's disease. So Alzheimer's disease, mostly they have a condition called the apraxia. It's apraxia. A neurological symptom may be, if it is neuron or nervous system, it will not coughing, it's not bleeding, it's not sneezing, but it's going to be paralysis, which is cannot move the muscles or part of our body because there is no order from the nervous system. The patient is having difficulty sleeping. Which of the following agent may be prescribed to in the sleep? Okay. Antibiotic, this is for bacteria. Okay. Antihistamine, this is for allergy. Analgesic is for pain. Okay. So this is pain, allergy, bacteria. So the correct answer will be hypnotic. And this is for induced sleeping. Match the medical term neuroplasty with its closest definition. Neuroplasty. So this is related to nervous system. Plasty means the repair. Okay, so repair. Okay, so the surgical repair. So it's going to be surgical repair of nerve. Pains in the head. Pain, algia. Okay, head is cephalo. So just combine together. Okay, it's going to be cephalgia. Pains on the head or in the head. Pains in the head, it's the same. So I think it's double. Okay, double question. Next, match the combining form of encephalo. Again, this is head. Okay, so encephalo, and then this is cephalo is head. Encephalo is actually inside the head. Okay, inside the head, which is the same as the brain. Okay, so encephalo mean brain, cephalo mean head. What's the combining form of meningo? Okay, meningitis, for example. Okay, so it's going to be related to meninges, which is layers of the brain and spinal cord. Okay, that's meninges. These carry information from sensory receptor to the central nervous system. Okay, you have receptor. It will be carried by this neuron into your head, okay, into your brains over here. Okay, so this neuron that carry that information is called a sensory neuron or afferent. Okay, afferent neurons. So the answer will be A. These carry order from central nervous system, so from your brain. So let's say this is your brain, this is the spinal cord. This will be carry the information to the maybe muscles or gland. Okay, it's going this. Okay, so this neuron over here is called the efferent or motor neurons. Okay, the one that carry order for your glands and muscle. The brain is protected by the, so which one protect the brain? Of course, it's gonna be the skull, okay, which is the cranium, right? The bones of the head is called the cranium, okay? A special bone that protects the brain, part of the skull bone. These cavities within the brain contain cerebral spinal fluid. Okay, so what is the name of that cavity? So if you have brains like this, okay, so you have cavity inside the brain, and that contain the spinal fluid. Okay, that cavity is called ventricles. Okay, there are 4 ventricles actually inside the brain. Okay, so 4 ventricles. Okay, so the space is called ventricles. The client has experienced a head injury to the frontal bone. The healthcare provider identifies that this injury may affect what? So frontal bone. Okay, so let's say this is frontal lobe, this is your brain, okay, and this is on the back. So the frontal one over here is used for action, okay, and emotions. Okay, the back one over here is for sensations. Okay, so if it is frontal bones that get injured, it may be affecting your action and emotion. So action and emotion. Okay, so this is frontal. Okay, this is the back. Okay, maybe occipitals. The client has experienced head injury and the occipital bone. So again, if this is frontal, this is brain like this. This area is called the occipital. Okay, occipital lobe. And this is the one that used for sensation of vision. Okay, so the sensation coming from eyes will be processed by this occipital lobe. So what happens if it is have problem? Then will be affecting your vision. The system is activated under stress. Okay, under stress. So you have what we call the ANS, autonomic nervous system, is actually divided into 2 types. The first one is called the sympathetic, okay, division. Okay? And the second one is called the parasympathetic division. Okay, so the sympathetic division usually work during stress, angry, okay, anxious. Okay? So this is controlled by the sympathetic division. So the answer will be the sympathetic nervous system during stress. Okay? The parasympathetic is usually during normal time. Okay, normal reaction. The client has paralysis on one side of her face. The healthcare provider suspect this as, so only one side on the face has a paralysis. This is known as Bell's palsy. So Bell's palsy, that's the answer. Deteriorations in mental capacity, particularly in the elderly, is called, so forget everything. So mental ability is really severe attack, and this condition is called a dementia. So dementia mostly in older people, elderly. The nurse administer an agent that causes the pupil to contract. The nurse identifies this agent as, what's that? Eye drop, antiseptic, of course not. Antibiotic is not. Maybe eye drop, but eye drop, is not really causing this pupil to contract. The right answer will be miotic. Okay, so miotic is something that can cause pupil to contract. The nurse assesses the patient response to the light by checking what part of the eyes, light. Okay, light enter into the eyes, okay, through the holes is called pupil. Okay, so therefore, this one will checking the pupil, whether open wider or smaller. So pupil is the hole of the eyes. It's used by light to enter. Match the combining form lacrimal. Lacrimal. Lacrimal means tears. Okay, so this will be the answer. Tears. Lacrimal. Sclero. 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 This is mean the white of the eyes. Okay, so if you have eyes like this, you have black one. Okay, this is the pupil and iris, and this is the white. The white is called the sclera of the eyes. Match the combining form of Paco. Paco. So what is Paco? Paco means the lens of the eyes. Okay, so Paco means lens. Ophthalmo. Ophthalmo. So ophthalmology. This is the study of the eyes. Okay, so eyes, ophthalmo, right? Oculo also mean eyes. Okay, so there are several terminations, okay, for terminology for the eyes. Ophthalmo, oculo, presbyo. Presbyo, what does that mean? Presbyo usually happening in the older people when they cannot really see the object closer. So when they read the newspaper, it's gonna be put farther from their eyes. So this is mean old. Okay, old eyes. Presbyo mean old. Naso, naso, nasal, nose. Very easy, very close. Naso, nose. Auro, auro, auro. Auro mean the hearing. It's related to ear, so this is hearing. How about audio? It's the same. This is also hearing. Okay, so audio, that's related to hearing. Ceromino. Okay, ceromino. This is something that present inside our ear, which is wax. Okay, this is wax. Oculo, I already mentioned that. Oculo, ophthalmo mean eyes. Okay, I think that's all. And then good luck for your midterm. I'll see you again next.